As you can all see here, this is a screenshot of the atherosclerosis section of the 2013 first aid. Now, our job as instructors is to integrate multiple areas of first aid into one section, in addition to adding high-yield information that may be missing in first aid, but then comes up when taking the MBME assessment exams. So in looking at atherosclerosis, we see that first aid defines it as a disease of elastic arteries as well as large and medium-sized muscular arteries. The risk factors here are divided into modifiable and non-modifiable risk factors, but what the questions are going to ask is, which of the following is the most important modifiable risk factor for atherosclerosis? And the right answer here is actually hyperlipidemia. Lots of people think it's smoking, however, that would be an incorrect answer. In looking at the non-modifiable risk factors, we see that gender is listed, and then in parentheses, it says that men and postmenopausal women have an increase of atherosclerosis. However, first aid does not tell us why that's the case. And the emphasis of the why is what tends to be missing in a lot of these review books. So that's the tutor's responsibility to fill in those gaps when they deem necessary. Okay, so the reason for the increase in men and postmenopausal women is because estrogen tends to be protective against atherosclerosis. This is exactly the reason why we rarely see women that are less than 50 years old coming into the ER with cardiac-related chest pain. And moving on to the progression of atherosclerosis, we see that the pathophysiology is initiated with endothelial cell dysfunction. Now, the reason why I have this in a red box is because this is personally a question from my USMLE exam. Okay, what the question wanted to know was, which of the following is the initiating or precipitating factor of atherosclerosis? And the right answer here, endothelial cell dysfunction. Now, after that point here, we see that the macrophages engulf the LDLs that tend to accumulate in that area of endothelial cell damage. And after those macrophages engulf LDL, they're described as foam cells. These foam cells then accumulate to cause fatty streaks, and those fatty streaks basically signal smooth muscle cells to migrate to the area of damage. Now we see in parentheses, this involves PDGF and FGF. Now what the MBME questions are about this concept is that they want to know which of the following factors is responsible for navigating the smooth muscle cells to the area of damage. Now they're not going to put PDGF or FGF as an answer choice. The right answer here is actually platelets. So they want you to extrapolate that platelets are going to release the PDGF, and that is going to bring the smooth muscle cells to the area of the damage. After that point, we see that extracellular matrices are deposited. Then once the deposit gets to a certain point, we describe it as a plaque, and then multiple plaques then form complex atheromas. So we see in this histologic image here that within the box here we see cholesterol crystals. Okay, so when you do see that on histology, it's safe to say that this can be described as a complex atheroma. So first aid then proceeds to list out multiple complications of atherosclerosis. However, the questions are going to say, which of the following is the most likely complication of a long history of poorly managed atherosclerosis? Okay, the right answer to that question is going to be aneurysms, and we're going to talk about those a little bit more on the next slide. Okay, in terms of a location, they might ask you which of the following is the most common location. And we see here that overall the abdominal aorta is the most common. And of course, by the nature of the MBMEs, you have to realize that thoracic aorta will also be an answer choice. However, in this case, it would be wrong. They also describe a location as being affected as the popliteal artery. Okay, keep in mind, anytime that the patient has popliteal artery atherosclerosis, a symptom is commonly claudication. Okay, so that's squeezing leg pain that happens when walking long distances. Okay, one thing to emphasize here is that notice that first aid does not mention anything about treatment of atherosclerosis. Okay, so now the tutor would basically mention that statins are a drug of choice for treating hyperlipidemia and preventing atherosclerosis. They may also describe the mechanism of action of statins, which is, of course, an HMG-CoA reductase inhibitor, as well as side effects. Okay, so side effects of statins are commonly myositis and elevation of your liver enzymes. Okay, the reason for the myositis is because in inhibiting the enzyme that statins do, it also decreases coenzyme Q, which decreases your electron transport chain, which decreases ATP production, which leads to muscle cell lysis. Okay, so these are all topics here that your tutor would implement that aren't necessarily described in first aid. So let's move on to another topic.